All right, let's dive into an injury that's as dramatic as it is serious in the world of sports, the pectoralis major rupture. You know, a torn pec. We're going to break down what it is, how it's fixed, and most importantly, what the science actually says about making a comeback.
So picture this. You're pushing for a personal best on the bench press. You're giving it everything you've got. And then, suddenly, a loud, sickening pop from your chest and shoulder. That's it. That's the moment. For so many athletes, that's the sound of a complete pec tear. It's usually followed by some serious swelling, bruising, and this sudden, shocking weakness in your arm. It's not a subtle injury, that's for sure. So what exactly is this muscle we're talking about? Well, the pectoralis major is that big, fan-shaped muscle that covers your upper chest. And it is an absolute powerhouse. It's what lets you do pretty much any movement where you bring your arm across your body, rotate it inward, or lift it forward. So think, pushing, throwing, even just giving a big hug. Its raw power is exactly why a rupture is such a big deal. Now, you might be wondering, who does this happen to? While it can happen to anyone, the research points to a really specific group. It's most often men, usually between 20 and 40 years old. And no surprise here, weightlifters are at the top of the list, especially during the bench press. But we're also seeing it more and more in high-force sports like wrestling, boxing, and even water skiing. As sports get more and more competitive, the rate of this injury just keeps climbing. So, what happens when this powerful tendon just snaps right off the bone? How do you even begin to fix that? Well, for these really severe tears, the answer is pretty much always surgery. Let's take a look at how surgeons put the pieces back together. The medical world is really clear on this one. If you've got a complete tear, getting it fixed surgically and getting it done early is the way to go. It leads to much, much better results. If you wait too long, scar tissue can form, the muscle itself can shorten, and that makes the repair way more difficult and a lot less likely to succeed. The main goal of the surgery is actually pretty straightforward. You've got to re-anchor that torn tendon back onto the arm bone, the humerus. These days, surgeons have some cool techniques. They often use things called suture anchors. These are tiny little devices that get drilled right into the bone, and they have these super strong sutures, or threads, attached to them. Those threads are then woven through the tendon to pull it securely back where it belongs. Okay, so that's the theory. We know how the surgery is supposed to work. But what does the science say? What does the data tell us about how well it actually works in the real world? Let's dig in and investigate. To get a really clear answer, the authors of this review went on a massive hunt for data. I mean, they started with almost 7,000 studies. From there, they had to be incredibly picky. They filtered out duplicates, individual case reports, studies that weren't quite right, and what they were left with was a core group of just 8 high-quality reports. This whole process you see here is basically a funnel, making sure that we're only looking at the best, most reliable evidence out there. And this brings us to the million-dollar question, right? For anyone going through this, it's the only thing that matters. After all that, can I get back to my life, my job, my sport? Well, the data from these hand-picked studies gives us a surprisingly clear answer. Just look at this. You don't need to be a statistician to see what's happening. This chart shows the functional recovery rates from a bunch of different studies. And you can see almost every single data point is jammed way over to the right. We're talking success rates at or just about 100%. That means patients are overwhelmingly getting their arm and shoulder function back. It's incredible. And hey, it's the exact same story when we look at getting back to work or back to sports. Again, study after study shows return rates well over 90%. For athletes, for anyone with a physical job, this is just fantastic news. It proves the surgery isn't just fixing the anatomy, it's actually restoring people's lives. So how long does this all take? Well, when you pool all the data from all the studies, the average time to get back to full, unrestricted activity is about 6.2 months. You know, when you think about how severe this injury is, literally tearing a muscle off the bone, getting back to your sport in about half a year is a pretty amazing outcome. If there's one number you're going to remember from this, let it be this one. One of the biggest studies included in this review found a jaw-dropping 97.7% return to sport rate. I mean, it's really hard to argue with a number like that. Okay, so far, this all looks amazing. Almost too good to be true, right? And that's where we find a little catch. There's a problem hiding in all this positive data, and it's not a problem with the surgery itself, but with how scientists are studying it. Here's the issue in a nutshell. Researchers use words like acute repair all the time, but they don't all agree on what it means. So one study might say an acute or early repair is anything done within 3 weeks of the injury. But then you'll find another study that stretches that definition all the way out to 3 months. They're basically studying two different things but calling them by the same name.
So, why does this even matter? Well, it makes it almost impossible to compare studies apples to apples. It's like trying to find the best recipe for a cake, but one cookbook says a cup of flour is 120 grams and another says it's 150. You can't compare the results. This kind of inconsistency just slows down scientific progress, makes it harder to figure out the absolute best surgical technique, and basically adds a bunch of static or noise to the data.
And this messiness isn't just about definitions. It's everywhere. Even when it comes to tracking complications, which you can see here were thankfully really low overall, the reporting was all over the place. One study might track one type of problem, while another tracks something completely different. It makes it really tough to get a full, clear picture of all the potential risks.
So we've identified the problem. But the great thing is, the researchers didn't just stop there. They didn't just point out what was wrong. They actually laid out a clear path to fix it.
So here's the bottom line, the big takeaway. The surgery works, it's incredibly effective, and patient outcomes are fantastic. But to make things even better, to really fine-tune the techniques and nail down the perfect recovery protocols, the entire scientific community just needs to get on the same page. Standardization is the key that's going to unlock that next level of care.
And here's the game plan they proposed. It's basically 4 common-sense steps. First, standardize the definitions. Let's all agree on what acute and chronic actually mean. Second, use the same scoring systems to measure how patients are doing, tools like the DASH or SANE scores. Third, make it mandatory to report the exact physical therapy protocols used after surgery. And finally, we need bigger studies that are run across multiple hospitals to make sure we're looking at all different kinds of patients.
And all of this leaves us with a really powerful final thought. The way we do things now, even with all this messy, inconsistent data, gets almost everyone back in the game. It just makes you wonder, if we can get these incredible results with imperfect science, what could we achieve if every researcher, every surgeon was working from the same perfectly precise playbook? The future for treating this injury looks very, very bright.